Have you got a little one who's tiptoe walking and you're wondering who's the best health professional to see to help your child correct their tiptoe walking? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you a case study of a little one who we met recently here in our clinic. This little one is 2 years and 1 month old. He was one of twins and he has been on his tiptoe walking ever since he was about 12 months old. Mom had been really concerned and had seen the family doctor about it. They were referred to a podiatrist who then referred them on to an occupational therapist. Now, Mom had been seeing the occupational therapist for several months, working on tiptoe walking, and the occupational therapist did so weekly for several months before they finally said, "Don't think we're making much difference. Perhaps you should see a pediatric physiotherapist." And so Mom went to see a pediatrician before they finally found us here at My Favourite Physio, and we are Expert Paediatric Physiotherapists. We assessed this little one, and literally just watching him walk, we were able to diagnose that this child has diplegic cerebral palsy. That means that an event had happened that affected the brain development, and this little one is one of twins and they were born premature. That event that affected the brain development has resulted in increased muscle tone coming down into his legs. So he was affected waist down. His upper arm, so his hand function, was actually pretty good. Now, this occupational therapist actually did an assessment on the child's fine motor skills, which is hands and arm movement, and found that he was actually within norms. Yet, this occupational therapist decided to continue treating this child for tiptoe walking when actually lower limbs and gross motor skills is not the area of expertise for occupational therapists. It is actually the area of expertise for pediatric physiotherapists. So what resulted was the child was having therapy that was not effective for his tiptoe walking. And the worst part is actually the occupational therapist did not realize that this child had cerebral palsy and in fact had diplegic cerebral palsy. So after spending months of therapy and time and money, this family really got no outcomes for their child. So I thought I would jump in and share that so that those family who's out there concerned about their little ones with tiptoe walking, just to know, broadly, lower limbs and gross motor skills, jumping, hopping, skipping, is the area of expertise for a pediatric physiotherapist, not an occupational therapist. And if your child is assessed by an occupational therapist and looks at their fine motor skills, which is their upper arm movements, and the result comes out as being age appropriate, that is a sure sign that the occupational therapist may not actually be the right person for your child, and that really their fine motor skills are age appropriate. It's more important to look at their gross motor skills with a pediatric physiotherapist. So if you find yourself in that situation and you've been trying occupational therapy to correct your child's tiptoe walking, they've not been able to tell you the cause of their tiptoe walking, they've not been able to effectively treat the tiptoe walking, and you spend months of weekly therapy on it, it is time to say, stop. No more occupational therapy. I would like to see a pediatric physiotherapist. And we highly recommend that you see an expert pediatric physiotherapist, like one of our expert pediatric physiotherapists here at My Favourite Physio. So if you would like to speak to one of us, then the number to ring is 02-9790-4233. And if you know somebody out there who's got a little one who's tiptoe walking and they don't seem to be able to correct it, whether through all sorts of therapy or different types of shoes, why don't you like and share this video with them? Until next time, have a lovely day. Bye.